This morning on today's checklist, some questions that can transform our health. It's important for us to advocate for ourselves at our doctor's offices, but it can actually be hard to pin down what questions we need to be asking.
NBC News medical contributor and pulmonologist Dr. Vin Gupta is here with a list of 5 questions you should be sure to ask on your next visit to your primary care physician. Dr. Gupta, welcome.
Good morning.
So we've seen a lot of stories about this record high active drug shortages. So is that a good place to start? That first question to ask your doctor, should I still be taking this prescription?
Well, Kaylee, we don't ask this question enough, which is get a prescription checkup at least once a year, especially if you're older. 20% of older Americans, 65 years of age and older, are on at least 10 medications.
Really?
That's a lot of people.
Crazy.
That's polypharmacy. That's what we refer to it in the medical field. Too many medications predisposes to falls, other potential side effects, reduces the risk or the chance that somebody will stay on the medications they need to be on. So things I look out for when somebody's in my care: are they on pain medications? Are they on muscle relaxants? Benzodiazepines, that class of medications for which sleep aids are very common. Are they on any of those medications that we should inspect and potentially even say, you know what, you don't need to be on that medication anymore. Let's simplify your medication so you stay on the meds you need to be on.
So Doc, there are folks who are experiencing headaches that actually could be migraines. Why do you talk to your PCP as opposed to just going to the drugstore and getting some over-the-counter meds?
You know, Al, the fact is OTC medications don't work for migraines. 50% of migraines across the country, 40 million people impacted by it. 50% of those don't know they have it. And the big problem here is it's very debilitating. You or a loved one, our viewers out there, probably know somebody, if not themselves, impacted by migraines. Very debilitating, and up until a few years ago, we didn't really have great options. It was triptans, medications you can only take for a specific period of time every single month, about 10 days a month. And that's a problem because people may experience migraines more frequently. We now have new therapies. It's an incredible age now. We have new preventatives, new therapies, injection format, once a month you take it. Important to talk to your provider. You don't have to suffer.
How do you know when your headache is more than a headache and a migraine?
So one-sided, if it's accompanied by visual auras, halos, people sometimes see halos. They also experience maybe GI side effects as well. So it can be full body symptoms with a migraine.
You mentioned GI stuff. It's for a lot of people, this is a big one. GI discomfort. What's the latest on that, and where do we start? You
know, often people say, when we think about gluten, Chanel is one example here, we think maybe celiac disease, but that's not very common. 1 in 133 people have celiac disease. Gluten sensitivity, though, some studies suggest maybe 30% of Americans have gluten sensitivity. Same symptoms after a big meal: bloating, other GI side effects. Have a conversation. Minor dietary modifications might mean a much more pleasant quality of life. Have that conversation.
Can you test for gluten sensitivity?
You know, you can't, but you can test for the presence of celiac disease, and then you can periodically remove gluten from your diet to see and do tests.
See how you feel.
Now, the first time you go to a doctor, you typically fill out that long checklist about your family history. It takes forever. But is that something you should revisit every time you visit your doctor?
Kaylee, you know, 50% of patient panels, doctors with large patient panels, only 50% of family histories are ever elicited in a visit. The other 50%, many reasons why that may not be the case. Maybe sometimes the patient just doesn't know. So if you're out there, you haven't had that conversation, critical, because that can impact the timing of cancer screenings, of heart disease screenings, you name it. Also important to make sure you're not just focused on mom and dad, but grandparents, uncles and aunts. Get that full aperture, that full picture here to make sure you know what's going on.
Because you might have also genetic issues that your children have to worry about.
Absolutely. We talked about migraines earlier, Al. Migraines have a deep family history, genetic risk factor, the greatest risk factor for migraines. So beyond cancer, beyond chronic disease, migraines even.
I didn't know that.
What about sleep? I mean, that's the one which on this shift, not so much. But what do we need to ask about our doctor about sleep?
You know, poor sleep is an epidemic across the world, especially here in the United States. We think 80% of adults don't get that requisite 7 hours. In some cases, there's a medical condition now that underpins why we're getting poor sleep. So if you're somebody has daytime sleepiness, maybe you've been told by a partner you snore loudly at night. That combination, 1-2, you should have a conversation about sleep apnea. 80% of cases go undiagnosed. It's a big deal. Beyond poor sleep, it increases your risk factor for high blood pressure. other ailments of the heart and the lungs because of untreated sleep apnea. And oh, by the way, we no longer have to commit people to that CPAP mask. Very uncomfortable.
Because people don't want to wear it.
They don't want to wear it. Exactly, Chanel. There's new treatments now on the horizon that completely negate needing to actually wear that CPAP mask. Have a conversation. 80% undiagnosed. New treatments on the way.
All right.
We've really got to be prepared going into these appointments. Thank you so much, Dr. Gupta.
Thank you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.